The three most commonly performed procedures in Australia and in some other countries include laparoscopic adjustable gastric banding, or otherwise called lap band, Roux-en-Y gastric bypass, and sleeve gastrectomy. All of these can be done laparoscopically, or what is called keyhole surgery, which means there are multiple, maybe 4 or 5 small incisions about 1 centimetre long, and they use cameras and fine instruments, so there's really no major scars. Roux-en-Y gastric bypass is when the surgeon begins by creating a small pouch by dividing the upper end of the stomach. This restricts your food intake. Next, a section of the small intestine is attached to the pouch to allow food to bypass the end of the stomach and the first part of the small intestine. The small intestine is then reconnected from the pouch to allow ingested food and digestion enzymes to mix. I put links to the videos on this below if you want to see how it works, because it's a little bit complicated. On average, the hospital stay for patients who undergo Roux-en-Y gastric bypass is usually between 2 to 4 days, and if needed, the whole procedure is potentially reversible. With laparoscopic adjustable gastric banding, or lap banding, the surgeon implants an inflatable silicone band around the upper portion of the stomach, so that the band creates a new, tiny pouch that limits and controls the amount of food consumed because people feel full with much less food. There are a few pros to this choice, like it's reversible, there's very few scars, it's keyhole surgery, there's no cuts to the stomach, and it's a shorter hospital stay of about 1 to 2 days. The problems with these though are there are a range of other complications that can happen with the band, in particular slipping of the band or irritating the stomach. These can occur in about 1 in 3 people. Also, there are higher failure rates than initially thought, such that only 54% of people who get one keep it in after 10 years. And finally, the sleeve gastrectomy. This is basically where they remove about 75% of your stomach. That's what gastrectomy means, removing your stomach. With little stomach, you can't eat much food and you lose weight. It's pretty simple. It's also keyhole surgery, but as you can imagine, it is not reversible.